Please, I'd like to introduce to you our next speaker, which is Dr. Edith Mitchell, who will talk to us about side effect management. Yeah, thank you.
Thank you very much, and thanks for everyone who is staying here this afternoon to participate with us. You've heard a lot of information about many clinical trials, many treatments for gastric cancer, and I'm going to talk about the management of symptoms as well as treatment-related events. Because every medication has a potential side effect. When you combine one medication with another, that adds for increased risk of side effects. And then for most patients with gastric cancer, there can be other medical problems, hypertension, diabetes, and other medications that patients might be taking. So therefore, very important to discuss with the physician team, with the treatment team, as well as the clinical trials team, if you're going on a clinical trial, any medications that may be prescribed by other practitioners, as well as any over-the-counter medication that you might be taking. For example, how many people here have Tylenol in their medicine cabinet or somewhere in the home? Almost everyone. Tylenol interacts very unfavorably with a lot of chemotherapy agents. So therefore, if you're taking 2 or 3 Tylenol per day for headache or something else, make sure your doctors know about it. So in the next few minutes, I'll talk about these things. These are my disclosures for those of you who are expecting CME or evidence. So you've heard from others today, Dr. Ajani, Dr. Berlin, Dr. Ilson, on various chemotherapy agents and various agents for treating gastric cancer, as well as the therapies that are considered standard treatment now, as well as those new treatments that are in clinical trials. One important thing to remember, we've talked about treatment, but we can treat with the intended goal of treating for either advanced disease or adjuvant therapy, meaning after there has been surgical or primary treatment of the cancer, and then neoadjuvant therapy, where we're giving some combinations of treatment, radiation, chemotherapy, targeted therapy prior to surgery. So all of these are important, and the patient should ask, what is the intent of treatment? What is my expected outcome from the treatment, so that you know exactly? So supportive care is what we call the treatment of symptoms of the disease, as well as treatment of the side effects of therapy. So gastric cancer, it's very common. In some cases, and in most cases, it is not discovered or diagnosed very early, so that the patient may have had symptoms prior to the diagnosis of cancer. And frequently, many of the patients are very sick before they even come in for diagnosis. There can be weight loss, loss of appetite, there can be pain with eating, there can be nausea, vomiting, and other side effects that are very important. So for many patients, there may be extensive weight loss even prior to starting any kind of therapy. So for gastric cancer, supportive care is an important aspect of therapy, and every patient should ask their treatment team, what are we doing about the side effects of therapy, and will the treatment likely add more side effects, enhance the side effects that the patient already has, or add new side effects? So it's very important to discuss with the team therapy. Now, why is therapy likely to benefit the patient? So dose intensity is very important. It's important to talk about trastuzumab or FOLFOX, many of the drugs and regimen that have been mentioned today, But if the patient does not receive adequate amounts of that therapy, then the likelihood of the treatment benefiting the patient declines. So receiving an adequate amount of therapy on a regular schedule is very important. So there is a relationship between getting the medicine on time, and that is related to overall effectiveness of the treatment. So very important. One of the reasons why patients frequently don't receive their medication can be related to myelosuppression or low blood counts. So your doctors will tell you, we're checking your blood count, and it must be checked at a certain level. And if the level does not reach a certain minimum, they might decide to do what? Delay treatment, or hold treatment, or sometimes discontinue treatment. So myelosuppression with a low white count is very important, but anemia, that's another. And anemia can be a major contributor to fatigue, and fatigue being one of those areas. So maintenance of blood count, very important. And there are other organ systems that are important in determining whether a patient gets a full dose of treatment. So kidney dysfunction or low renal function, another. If the liver is involved with tumor or has other medical problems, liver dysfunction may be another reason to decrease the chemotherapy. And then for the common agents that we use, Folfox, cisplatin, and others, they can cause a neurologic dysfunction, and again, that might decrease the amount of medication that is prescribed. So very important to let your doctors know about any side effects. And what are the things that can affect dose reductions? Sometimes we reduce for age or body weight. Others, I've mentioned bone marrow dysfunction and other liver, kidney, lung dysfunction, cardiac disease. Someone mentioned heart function with trastuzumab earlier today, and that was a cause for total discontinuation of the medication trastuzumab or Herceptin. So again, very important. Nutritional status, socioeconomic factors, and others. So it's very important. This is just a slide to show that we try to balance toxicity with the target amount. So we don't want the patients to either experience serious toxicities, and we try to find that optimal dose for every patient. Nausea, vomiting. With gastric cancer, many patients have experienced nausea, vomiting, pain after eating, fullness as it is described sometimes prior to diagnosis. And certainly after treatment and associated with treatment, there can be additional nausea experienced by the patient. So it's very important to, is there a pointer?
Right there, the box, the block, yeah, right there.
It's very important to relay to your treatment team information. Now, this was a study done by a large group of physicians led by Dr. Grunberg, and it evaluated what the patient said and what the doctor said. So the patients are in yellow, and the doctor team and nursing team in purple. And note that for acute nausea, while the patient is in the office receiving chemotherapy, that they were right on target. The doctor said the same thing as the patients, because if there's vomiting in the office, somebody knows it. But how about delayed nausea, vomiting? 3 to 5 days after treatment. Note that what the physicians and nurses thought was quite different and much lower than what the patient said. So again, it's very important. If you have nausea and vomiting later, after you've received your treatment several days later, make sure your medical team knows about it, and they can then enter that into your treatment planning regimen. So very important to communicate that. And why is it important? Because, let's go back one, 50% of patients who for some reason stop treatment, don't take treatment, don't come in for treatment, guess what it's due to? Nausea, vomiting. So make sure your team knows about it, and therefore they can prescribe additional medications. For anemia, it has been shown for neutropenia, that's low white count. Note that with receiving therapy that addresses the white count, such as Neupogen or Neulasta, note that the incidence of low blood cell count drops precipitously, so that your doctors may prescribe medications to help keep the white cell count high. So that's another important area for treatment. And it's important for all phases of treatment, whether it's chemotherapy, radiation, surgery, or whatever. Adequate white cell count, adequate red cell counts are very important. So the neutropenic risk is there, and you want to discuss that with your team, especially if there has been any associated pain or fever at home. So things to remember. Anemia, many patients are going to have anemia prior to the diagnosis of cancer. So consequently, effectiveness in treating anemia, very important, and it is so important to discuss with your team whether or not fatigue is associated with your illness. Many patients think that, well, you got to feel tired with cancer. The answer is you do not have to feel tired with cancer, and there are things that can be done, can be included in your treatment regimen to facilitate and resolve some of the symptoms of fatigue. These are the NCCN guidelines. You've heard us mention NCCN guidelines several times today, but just basically showing whether the patient is asymptomatic or symptomatic. So again, let your doctors and the treatment team know. These are factors in maintaining and treating anemia, some of which your team may think about, may ask you questions. But for example, Dr. Norton mentioned in the surgery of stomach cancer this morning that iron absorption may be decreased, that B12 deficiency might occur, so therefore important to ask about these things. Nutrition. Nutrition is absolutely important in this disease, and for gastric cancer, it is probably the most cancer, or the cancer where nutrition is most important. Again, because cancer involving the stomach may affect nutrition, and cancer treatment, whether it's chemotherapy, surgery, or radiation to the stomach, can affect nutrition. So nutrition is very important, and in the assessment, it's very important to know the patient's condition, their overall height and weight, and not necessarily the height and weight when they come into the office, but I always ask my patients, what did you weigh a year ago? Because I want to know what your nutritional status and what was your weight at a time when you were less symptomatic or asymptomatic prior to the diagnosis of cancer. And then you will want to ask the team, with this treatment, is my nutrition going to be worse or will it be affected? So that your team can provide information and recommendations to you. I am frequently asked, Doctor, are there any foods that I should be eating? And I always say, absolutely yes. Those foods that you like, that you have eaten all of your life and that have been a part of your family. So those things that taste good that you're likely to eat. I'm also asked, well, should I eliminate all sugar from my diet? And the answer is no. You've heard earlier today that nutrition is important, that cancer cells obtain their sugar, their nutrition through non-aerobic or non-oxygen related processes. So your eliminating sugar from your diet is not going to prevent cancer cell growth. The cancer cells are going to grow. They're going to get their nutrition by some mechanism, and that mechanism usually involves weight loss, and your own liver converts the proteins to sugar for the cancer cell. Your heart, lungs, brain, kidneys all operate on processes that involve sugar metabolism. So you need some sugar in your diet. A well-balanced diet, very important. For stomach cancer, cooked foods are digested more easily than raw foods. So basically, soft cooked foods would be much better. And I tell my patients, if you have a choice between a rare steak and beef stew, choose the beef stew, or chicken stew, or other foods that are well cooked. And it could be vegetarian or non-vegetarian, but just make sure you have an overall well-balanced diet. And ask for a dietitian consult. Most institutions have some dietitians who can be helpful to you. Oral mucositis just means irritation of the mouth. That can occur with chemotherapy. It can occur with the targeted therapies, radiation, and sometimes postoperatively there can be infections that affect the mouth. And this is just a picture to show the various phases. So this is the oral mucosa, and it can be totally denuded so that there are ulcerations. If you have dental problems already, mention them to your team. If you have not seen a dentist recently and you're getting ready to start therapy, I usually recommend to my patients, go see the dentist while we're getting your CAT scans and everything set up. Because again, if you develop ulcerations, like here, your therapy may have to be delayed or may be discontinued. So again, oral nutrition, very important. And these are just some of the risks for developing oral ulcerations or problems. If the patient is already malnourished, it's more common in individuals who are, I don't say elderly anymore as I age, but I say more experienced individuals have a higher risk of oral complications than younger patients. Those with poor dental hygiene have a higher risk, so I always emphasize dental care, good mouth care during treatment, very important. So ask your provider team, how should I take care of my mouth? What kinds of materials should I use? Toothpaste, mouthwashes, all very important. And especially the alcohol-based mouthwashes can be damaging to the oral mucosa. So if there's any one thing to eliminate, it's alcohol-based mouthwashes. So another important area. Now, just a little bit about the various therapies. You've heard about the VEGF inhibitors from Dr. Ilson and others, so I won't talk about the mechanisms, but again, they're all important, and these are various agents that are available and approved by the FDA for certain treatments. One of the risks of these agents is hypertension. So about 20% of patients who've never had high blood pressure will develop high blood pressure on these medications, and another group who may have already had hypertension will have worsening of the hypertension. So again, very important to let your doctors know what you're taking because they can therefore recommend various agents for treatment. So hypertension is not a contraindication to receiving these medications. The hypertension in almost every case can be appropriately and adequately treated. So having high blood pressure is not a problem. It just needs to be managed. Your doctors or nurses may ask some time for urine specimen looking for protein in the urine. Again, that is usually a complication that can be managed. Trastuzumab, or Herceptin cardiotoxicity, was mentioned this morning by one of the patients who indicated that he developed heart problems and the drug had to be stopped. This is taken exactly from the FDA's warning about this medication, cardiomyopathy and cardiac monitoring. So make sure your doctors know any information that you have historically that might be related to the heart and might offer some information. So cardiac function should be evaluated prior to starting this medication as well as during treatment. And certainly we have had patients on these medications for years actually with no heart disease, but we do have to continue monitoring. There could also be infusion reactions, lung toxicity, and others. So again, if you experience any new side effect, shortness of breath or whatever, don't assume that all cancer patients must experience those things. Let your team know about them. And the epidermal growth factors we've mentioned earlier, skin rash from panitumumab and cetuximab can occur. They can be managed. They can actually be prevented. And this was a study we directed a few years ago showing that if you prevented the skin toxicity, you could also prevent other problems. And note that with a reactive skin treatment, we had and this is prophylactic, so this is prevention or just waiting for the patient to receive skin toxicity. Note that with the prophylactic reaction or therapy, we decrease the number of patients having skin toxicity, skin itching, pustular rash, and so forth. So these can be prevented. And we also, by taking care of the skin, decreased more nausea, decreased diarrhea for patients, as well as other toxicities. So make sure your doctors and your team know exactly what you're going to expect, that they discuss it with you, and ask the doctors and nurses, are you likely to have any new side effects or worsening of others? This was just ramucirumab. Several people have mentioned earlier today, and again, side effects. And one of the side effects of this medicine, note the most important one or the most frequent one was nose bleeds. So again, if these occur, let the doctors know. So in summary, what we can say is that patients can tolerate treatments. Patients don't have to feel that they have to suffer from treatment. Many of the side effects can be prevented. What is important is communication with the healthcare team so that the team knows what you experience, that they know what medications you're already taking, and therefore can do a preventive treatment plan for you prior to initiation of any therapy. And with a carefully designed symptom management plan, most patients can receive optimal therapy and therefore optimize the amount of treatment, decrease the side effects from treatment, and therefore are more likely to receive adequate treatment, the right amount of therapy, on the right schedule, at the right time, thereby optimizing and giving the best options for a good treatment outcome and results from therapy. With that, I thank you very much for your attention.
Great. Thank you very much, Dr. Mitchell. We have had quite a few questions come in. I'm going to start with a couple online. Questions are coming in. Other than, for blood counts, that a lot of patients get, we're going to answer some questions here, fatigue. And so we've had quite a few questions on fatigue. As long as their blood counts are regularly checked on a regular basis and, they get put on Nuelast if they get too low, is there anything else that you can recommend for fatigue?
So fatigue can be caused by a number of problems. Some of them may be drug-drug interactions. For example, I mentioned Tylenol. Tylenol interacts with a number of medications and can decrease the metabolism of the medications, thereby allowing that medicine to stay in the system longer. So if the patient, for example, is prescribed Valium or Ativan or Xanax or Ambien for sleeping, and then they take Tylenol during the day, these medications can therefore have a delayed metabolism, and therefore the patient feel tired and sleepy the next day after taking an Ambien for sleeping at night. So there are a number of factors that can contribute to fatigue. And the main thing is to discuss it with the healthcare team so that they can look at all of the medications that the patient is taking, making sure there are no drug-drug interactions that we need to change in order to decrease fatigue. Another area, the cholesterol-lowering medications. They can interact with many of the chemotherapy agents. For example, how many patients here take Lipitor, Crestor, or something like that, or have taken it? Most people in America either take them now or have taken them. And if you're on the regimen of Folvox, for example, the 5-fluorouracil in Folvox can be inhibited by Lipitor or others. So again, there are a number of contributing factors to fatigue, including the cancer, including the treatment, but there are a number of factors that can be modified, thereby to decrease fatigue that patients experience.
Okay, great.
And exercise is another. I don't want to take the place of my colleague who's going to talk about that, but yes, there are complementary and integrative medicine experiences and modalities that can, of course, decrease fatigue. And our next speaker is going to talk about that.
One other question that came up is, some of these agents, like the platinums and so on, they do cause, peripheral neuropathies. Is there any treatments for neuropathies?
Are many of the chemotherapy agents, including cisplatin, oxaliplatin, docetaxel, paclitaxel. There have been a number of clinical trials that have evaluated multiple medications, and I have some patients who tell me, oh, that medicine made a big difference. Everything is improving. Others say there was no improvement. But all of the clinical trials have demonstrated no effectiveness of any single agent or any combination on either the progression of the neuropathy or the resolution of neuropathy once it has occurred. So bottom line is, we don't have any medication that consistently has demonstrated a benefit to patients. Now, that doesn't mean that some patients might not experience some benefit from various agents. So there are some that are routinely prescribed, but clinical trials have not demonstrated a routine predictable response and improvement or prevention of neuropathy.